Wonderful. Maybe one more time. Good morning. Thank you so much. Welcome to the MPHA Annual Awards Spring Breakfast. My name's Steve Radini. I use the he series pronouns. I'm president and CEO of Health Resources in Action, and I'm also the MPHA board chair. Well, thank you.
And good morning, everyone. My name is Rashana Moore Evans, and I am the executive director of the Harvard and the Legacy of Slavery Initiative, and I'm also the president-elect of MPHA's board. So thank you all for being here today, supporting MPHA and celebrating our accomplished awardees. Once again, this morning's event is sold out. As we can see that there's hardly any chairs that are remaining. I tell you that because it is a sign of the energy, and every time I come to these events, there's so much energy, so many great people wanting to do many great things, and I'm really excited that you all are here today, and you're really here to celebrate with us, our awardees, and also you being here today is a sign of your commitment and your shared commitment to health equity. Please know that we are grateful for each and every one of you in this room. You all are critical to MPHA's work, whether you are a longtime ally or are just joining us for the first time. So I did this last year. We're going to do a little bit of an exercise. I want to get a sense of who's in the room today. So can you please raise your hand if you have attended a Spring Awards breakfast in the past? Wow. All right, so keep those hands raised if you've attended 5 or more awards breakfasts. Wow. All right, exciting to see some long-termers here. So you can lower your hands, and if this is your first time, please raise your hand. What? Wow. So we are so glad that you are joining us for the first time. We hope this will not be your last. And now, please raise your hand if you participated in the Catalyst Corner this morning. If you were able to write down a note around why you are a Public Health Alliance supporter. All right, so I don't see many hands raised. That means there's some work for you to do after this event is over. So this here is the Catalyst Corner, and we hope that you notice it right outside the room. We are creating an interactive installation that offers an opportunity to share why you are part of a movement for health equity. And I was telling someone today that today is like Health Equity Week because there was just a Health Equity Compact event yesterday. How many of you all attended that event? All right, a couple of you all, okay. So on your table, there are Post-its and a prompt. If you are inspired at any point this morning, use the black Sharpie on your table and tell us why you are or want to be part of a Public Health Alliance. And now one more, please stand if you are a past MPHA awardee. Wonderful. Thank you so much for being here and your ongoing engagement with MPHA. We welcome you one and all because we need each of you as a partner and an ally in our work. For those who have been here before, thank you for being steadfast. And if this is your first time, we hope it will not be your last. And to our past awardees, joining us again, it is an honor to have you back with us today. Today we are here to celebrate 3 champions of public health and pioneers for health equity, people who have been in this work long before the phrase health equity had the cachet it may enjoy today. Our awardees have charted very different paths, from a social worker whose passion and compassion took him to the White House, to a physician leader whose most recent chapter took him back to his hometown of Springfield to run its largest healthcare system, and to a dynamic and driven champion of immigrants' rights whose work makes people safer and healthier in her adopted home of New Bedford. MPHA is proud to be making these awards, and we are pretty excited for the celebration.
Before turning to the awards, we have the privilege of thanking some of our key supporters. First, a huge shout out to all of our sponsors. You've seen them on the slides before you. We also want to say thank you to our platinum sponsor, Gilead. How come there's no applause? That's better. And to our gold sponsor, Bay State Health. This event, which is really a recognition of all of us in public health, and in particular today, a few people, is also an important fundraiser for MPHA. It's these resources that keep this important group moving forward and doing the policy systems change work that's so critical to our work in health and racial equity. As board president over the last year and a half, I get to work with an amazing group of people. You'll see some of the other board members come up in a minute, but maybe if we could ask board members to stand, those in the room today, just to recognize them for their amazing work. The MPHA board is a working board. When Carlene and Neil asked me to join, I didn't realize how much work it entailed. It speaks to the power of the work, not only of the board, but also the small and mighty staff. Maybe we can just ask the staff to stand for a minute as well. Thank you for all your incredible work. The board has been really busy over the last year working on a strategic plan, but also thinking about some other things that will be revealed throughout the day. You'll be hearing more important information from Omi and Carlene later this morning. And over the course of the next few months, we'll be sharing this information across the Commonwealth as MPHA approaches its 150th anniversary. Woo!
So there are changes that are coming, changes that will even more fully align MPHA with our growing and deepening commitments to racial justice and to listening to those who experience oppression as we develop our priorities. So please stay tuned. And one more thing before we begin, I want to thank the staff again. The staff are amazing. It's a small but mighty staff. They are deeply committed. So let's just give them one more round of applause for all of their work. This team is a driving force behind MPHA's effective work.
Now it's my honor to welcome to the stage the Commissioner of the Massachusetts Department of Public Health, Dr. Robbie Goldstein. Dr. Goldstein was appointed by Governor Maura Healey and Secretary Kate Walsh into this role. During his tenure, he has shown himself to be a champion of public health, an effective leader of a large and diverse state agency, and a true partner. I know in the conversations I've had with him, this is an individual who leads with his head and his heart. Prior to this appointment, he served as Senior Policy Advisor at the Centers for Disease Control and Prevention, as an infectious disease physician at Mass General, and as faculty at Harvard Medical School. At MGH, he helped founded the MGH Transgender Health Program, a multidisciplinary clinical program that creates a safe and affirming environment for the transgender and non-binary community of Massachusetts and New England. Thank you. It's kind of fun putting him on the spot because this is not his thing. Since coming to DPH, Dr. Goldstein has prioritized racial justice and health equity by not only creating a position at the assistant commissioner level, but also developing DPH's first health equity strategic plan. I'd encourage you to take a look at it. You're a leader in the field in this state, but also in the nation. Thank you for being here today.
Thank you for that. It is not normal for me to stand up here. I think I'm bright red as that introduction was happening. But good morning, everyone. It's really great to be here with you this year and to be back with you and to see so many people who have become friends and colleagues over the past year. At last year's breakfast, you might remember I was just 6 weeks into my time as commissioner, and you really welcomed me at this breakfast. and you have welcomed me over the past year. I'm so grateful for the partnership of everyone in this room, and in particular for all that you've taught me this past year. That's true for the staff at the Department of Public Health who are here, from our partners like MPHA, and from all of you. 'Cause collectively, we are doing meaningful work across the Commonwealth every day that advances public health. So recently, I have been reflecting. I've been reflecting on the work of the past 12 months, on the highs and the lows, the successes, the challenges, and the people whose commitment and perseverance and heart are present in so many of our collective accomplishments. I want to take some time this morning to walk through some of these reflections and to highlight how this work, this really hard work, sets us up for continued success and an even greater impact in communities across Massachusetts. So if we think back a few weeks after I started at DPH, both the federal and the state COVID-19 public health emergency ended. And it was not a surprise to any of us in this room. We had turned a corner in our response to the pandemic, and the much anticipated announcement of the end of the PHE symbolically represented the closing of a very difficult chapter for public health. In reality, none of us in public health, none of you, simply moved on. We all took a collective deep breath, we acknowledged our fatigue, and we pivoted. We rededicated ourselves to working with communities and residents across Massachusetts to help to protect them from respiratory viruses, adapting our work to the new phase. As everyone in this room knows, a public health threat doesn't just go away, it evolves. And we in public health don't go away either, we persist. A month after the public health emergency officially ended, we were all hit by new information in another ongoing and devastating public health crisis, the opioid epidemic. In June of last year, the department put out a sobering report on opioid-related overdose deaths in Massachusetts. In 2022, the Commonwealth experienced the greatest number of opioid-related overdose deaths ever recorded. We had lost 2,357 people to the disease of addiction. And while this could have been a moment to place blame or to accept defeat, we persisted. We took this tragedy and we saw opportunity. We thought bolder, we looked deeper, and we pushed ourselves harder in the efforts to address the ongoing opioid epidemic. DPH put out more funding for communities. We centered those with lived and living experiences. We became the first state to fund a hotline to support people who are actively using drugs, giving them a resource to never use alone and allowing us to intervene to prevent overdose deaths. And in December, we released a report supporting overdose prevention centers, increasing understanding of these. I thought that might get applause. We increased understanding of these facilities, we worked to shift minds, and we are working to shift policies across the state. OPCs are an evidence-based, life-saving tool. Their establishment is part of a comprehensive public health approach to addressing substance use and overdose risk, and we want them open. We want them legally protected. And we're working with all of you to pursue those legal protections through and in collaboration with the legislature and with municipalities across the state. A month after we released the opioid-related overdose death report, we came together to discuss more devastating data on severe maternal morbidity. These data showed that not only have we seen an increase in the rates of severe maternal morbidity across the state, they showed that the disparity between Black birthing people and white birthing people has increased over the past 10 years. That troubling and jarring report told the story of long-time systemic failures. Severe maternal morbidity is largely preventable. Most of these events could have been and should have been avoided. We stared directly at the data, and we loudly and boldly stated the true cause of these disparities: racism. As a department and as a community, we committed to declare racism for what it is: a serious public health threat. The declaration That declaration is not something novel for a Department of Public Health to make, but it is a necessary step. And these are words that we all must not just say, but also believe profoundly and act upon determinedly. We all must commit to calling out racism when and where we see it, and to do whatever it takes to confront it, address it, and eliminate it. At DPH, we took this commitment to the next level. We updated our vision and mission statements and our strategic priorities to explicitly focus on addressing racism and racial inequities. And with the help from many of you, in March, we released and started implementing a department-wide strategic plan to advance racial equity, which is an action-oriented roadmap to address underlying structural concerns built off of systemic racism that have perpetuated health inequities across the state. And I know that those of you here in this room today share this commitment to meaningful change for Black, Indigenous, Latino, Asian, and Pacific Islander people in the Commonwealth. And I know that many of you have been deeply engaged in these efforts for years. Together, we can transform and improve public health outcomes for all people in Massachusetts, especially those facing the greatest barriers and experiencing the very real and very destructive health impacts of racism. Over the past year, each of us has been touched by the increasing demands on the state's emergency assistance program, whether at work, at home, or in our communities. And each of us, in our own ways, has contributed to efforts to support the public health needs of those in shelter, for those newly arrived in Massachusetts and for those who are longtime residents. Each day there are hundreds of families that are looking for housing and support across the state, turning to community-based organizations, healthcare providers, city and town governments, and the state for what they may need. These are families. These are young children. These are pregnant people, new parents, and parents of children with complicated medical needs. These are people who have traveled a long distance, risked everything, and people who have put their faith and their trust in us. And I am so proud of the ways that public health has responded to this crisis. We are all doing our best to support and to care for those who need us most. We continue this work with compassion and empathy. We do it without prejudice or stigma, and we put public health principles first. In October of last year, we hit a milestone in our collective efforts to do our work better and to better serve people across Massachusetts. The department announced the establishment of a set of performance standards, credentials, and workforce training requirements for local public health departments. This was many, many, many years in the making. These standards, developed in collaboration with local public health and with the support and hard work of many of you in this room, are being used to bring resources and solutions to cities and towns across the state, providing local public health with necessary data to recruit additional staff, deliver training, and strengthen services. And while this is a milestone to celebrate, our work is not yet done. Sitting before the legislature right now is the statewide Accelerated Public Health for Every Community Act, SAFE 2.0. This bill proposes a once-in-a-lifetime substantial expansion of local public health services, codifying into law portions of the Special Commission's Blueprint Report. SAFE 2.0 is exactly what is necessary to transform our local public health system to meet the needs of today and tomorrow. It allows us to fulfill our obligation to the residents of Massachusetts. It gives public health the necessary tools and the respect it deserves. And SAFE 2.0 is how we in public health persist, no matter the threat, no matter the community. Our work over the past year has not been without opposition. Trust in public health remains a challenge. Vaccine hesitancy persists. We've seen continued attacks on LGBTQ rights and gender-affirming care. And reproductive health care has been under constant attack. The right to safe, non-biased, medical care is no longer protected in this country, and we cannot allow that to happen in Massachusetts. As part of efforts to protect and improve access to comprehensive reproductive health care, the department is taking action. We are specifically addressing and educating people about the activities at anti-abortion centers, previously called crisis pregnancy centers, or CPCs. In Massachusetts, anti-abortion centers outnumber abortion providers 2 to 1. In January, the department issued guidance to all licensed facilities and professionals outlining and underscoring their obligations to provide the standard of care to patients, including providing complete information on reproductive health options and not providing misleading information or using deceptive practices. This notice served as a strong reminder of the requirements of licensure. It was accompanied by a statement from me highlighting our position supporting access to the full array of reproductive health options in this state, including abortion. We will not stop in these efforts. We will protect the rights of people across Massachusetts, the women seeking care, the pregnant people looking for education about their options, and the medical providers who are doing this important work. We all need to raise awareness about the dangers of anti-abortion centers, and we need to stand in solidarity across the administration and across the state. So this year has been a busy year for public health. All of this has been happening, and we have persisted each and every day, as all of us here have also been carrying out the important day-to-day work, the hard work of public health. We've been engaging with communities. We've been working together to support those most vulnerable. We've been addressing healthcare quality, safety, and capacity concerns. We've been collaborating to support and grow the public health workforce. We have been doing the hard work. And I know this work often goes unnoticed, and I want you to know that what you all have done in the past year was noticed by me, by the department, by your colleagues here today, and by so many others. I celebrate and I applaud all of you with a special acknowledgement of today's award winners who are being honored for their incredible efforts and their careers of this service. So while so much has happened and so much has changed in the past year, one thing has remained constant: my awe. My awe of the collective knowledge, stamina, talents, and dedication represented in this room. So thank you all for your work. Thank you for having me here today, and congratulations to the honorees today.
Wow. Thank you, Commissioner. Thank you for your words, and thank you for your partnership, and thank you for your actual action. It's really something. Thanks. Good morning, everyone. I'm Carlene Pavlos, and I am the extremely lucky Executive Director of MPHA. It's so fun. I'm really excited to be with all of you here this morning. A lot of longtime friends and a lot of, I hope, new friends. I can't wait to meet some of you. So right now, I get to welcome one of those longtime friends to the stage, who is a recipient of the very award he is about to make, a past recipient of the very award he's about to make. Please join me in welcoming Harold Cox, Professor of Practice at the BU School of Public Health.
A long time ago, Douglas Brooks called me and he said, I'm going to apply for a job soon and I need some pointers about interviewing. And so Douglas and I got together and I put him through the Harold Cox torture. Douglas, I apologize to you. you still feel it. But he got the job. And then he used those same skills and information to get another job, and then yet another job. And I was thinking, I must really be good. But then I realized it didn't have anything to do with me. It has to do with the fact that Douglas Brooks knows how to put the capital P in professionalism. He knows how to put the capital E in excellence. And we have seen this in all of the jobs that I am familiar that Douglas has had. His work in Provincetown, at the Provincetown AIDS Support Group, with Justice Resource Institute, as President Obama's AIDS czar at Gilead Sciences, and now at the University of Pennsylvania. In all of those places, Douglas has exemplified professionalism and excellence. Douglas is also incredibly passionate and very caring about his work. And he also has something else that I want my students and me and probably all of you to learn. He has the ability to say no. Now, I don't know if you've ever had a conversation with Douglas, but I have. And that, we talk for a while, we get it going, and then suddenly Douglas kind of turns his head. Sometimes he walks out the room, but he's through. And the important thing is, Douglas has this ability to actually know, I'm not putting up with any more at this point. And it's so important. He also has the ability to ask hard questions and then to demand the appropriate answer. Our friend, Dr. Jean McGuire, was going to be here this morning, and let's just pretend like she's standing right here next to me. Jean sends her love, and she expands on this a little further, and she says, Douglas has made a lasting impact on the health of the Commonwealth because he has been an important part of our hopes and dreams, our struggles, and our victories. Douglas is quintessentially the best. He is caring, compassionate, strategic, generous, challenging, supportive, spiritual, and always political. So this award that Douglas is receiving today, the Paul Revere Award, is an award about excellence in public health. I want you to take a look at this bowl that Paul Revere, well, he didn't actually make this particular one, but he did design this bowl. And this bowl embodies something about, you want to take my picture? Okay, let's go for it. So this bowl Revere, I just lost my track because I'm with you. Come on, let's try it. Yeah, let's go. Wait. Okay. Okay, good. Oh, you want one from the rear? Oh, that's good. This is good. All right, good. Okay, so I am the eye candy for the day, and I am so glad to be here. At any rate, what the bowl embodies is something about craftsmanship. It's about, look at the design of that, how beautiful it is. So what does this craftsmanship say about Douglas? Well, if you've ever been in a meeting with Douglas, you'll see that he is someone who knows how to manage, manipulate, control, and to get, those are good things, and to be able to get the things that you want to be able to get. That's a craftsman at work. Also, if you think about the policies that Douglas was able to put forth both in President Obama's office as well as at Gilead Sciences, you know that Douglas is someone who understands about systems, who understands about how to work collaboratively with others. That's a craftsman at work. Now, our friend Jean added additionally, she says, Douglas is the epitome of intersectionality. He is my brother from another mother. He is religious and irreverent. He is queer and welcoming of all. He is broadly, proudly Southern and determinately progressive. He is a tennis and football lover and a high queen. This is Jean's work. He is smart, tenacious, strategic, while also being compassionate, caring, and supportive. He speaks truth to power and uses the power that he has had at will. He has accompanied many on the final paths, and he rails against the assumption that pain and loss are inevitable. For him, the personal is political, the spiritual is central, and being gay is a gift. Holding all these things closely is what makes Douglas a public health hero. So today, I am so proud to have you as my friend and my colleague. I am so proud of the things that you have done in the past, the things that you are doing right now, and the things that I know that you will be doing in the future. So on behalf of the MPHA board, I and we are proud to present Douglas Brooks with the Paul Revere Award for his decades-long commitment to marginalized communities, his focus on racial justice, and his dedication to accessible and health equity. Please acknowledge Douglas Brooks.
I'm going to need that. Thank you, Harold. I love you. And thanks to Jean in absentia. She really wanted to be here. Abby and I were just talking. Even yesterday, she's like, oh, well, maybe I can. I was like, Jean, you just had back surgery. You can't come. You have to stay. Thanks also to Carlene and Anna and Veronica and the entire team at MPHA. Thank you to Stuart and Cheryl for, I think you nominated me for this award and for your long-term friendship and collegiality. I want to acknowledge the other award recipients who are doing amazing work in your communities and in our state. Thank you for that. Commissioner Goldstein, thank you for being here. I hadn't had the opportunity to meet you. I have to say, when you came up here, I turned to my friend and said, the Commissioner of Public Health is young enough to be my son. Time marches forward. Commissioner, I wanted to ask a question. You mentioned Save 2.0. Should we be calling our legislators and state reps and asking them to vote for it? Okay. That's what Harold meant by manipulate. I want to acknowledge all public health leaders from across the Commonwealth, present and past, and in particular, where's Kevin Cranston? Oh, there he is. In particular, Kevin Cranston, last year's recipient of this award, and someone who strongly supported my leadership and efforts to make a difference, and whose investments in my own development and growth still mean the world to me. And I didn't know, but I ran into former Secretary of HHS, Massachusetts, Secretary Johnston is here. Thank you so much. And I have to call out my friend Andy Epstein. Thank you for all your service. You were there for us when no one else was. Many of you know, but some who are here, and especially some of my friends, likely don't know, that in 1799, the Boston Board of Health was established to combat any potential cholera outbreaks. This act launched the nation's first governmental public health organization with Paul Revere as its first commissioner. The descendant of that board is the Boston Public Health Commission. And the first black woman to be the permanent head of that 225-year-old organization is here this morning. And I want to thank Dr. Bisola Ochikutu for your leadership and your friendship. Thank you. And I also want to acknowledge my sister, Nancy Norman, who indeed was interim director for a period as well. So I think that's what these things are for, right? You thank the people who help you get here. I want to acknowledge and really thank the lovely people at Gilead who made the decision to come in as the platinum sponsor, my former employer. So I'm very grateful for that. And then I arrived this morning to find that the University of Pennsylvania School of Social Policy and Practice and the Boston University School of Social Work, from which I graduated, also supported this event. So I'm deeply grateful for that. Personally, I want to thank Mark and Michael and Dylan and Tom and Sean and Jimmy, who came in from Provincetown and Truro to be here with me this morning. I want to thank you, Jimmy McNulty, for always dancing with me. I want to thank Ann and Stephen, who drove in from Concord. And Stephen, I want to thank you for always, always taking care of me. And when I was too sick to take care of myself, feeding me and taking care of me. And thank you for marrying Rufus and bringing Ann into our lives. Andrew, Gary, Chioma, Bradley, Nancy and Cheryl, David and Sharon, who are all here from Boston, my fam, my peeps, thank you. I'm so glad to have you here. So I chose social work. It was a clear and intentional pathway. Public health chose me. I was reminded of that a couple days ago when we commemorated the 43rd year since the publication of the CDC's MMWR, in which the epidemiological notes and reports was titled Pneumocystis pneumonia, Los Angeles. Those words signaled the emergence of what became the HIV pandemic. I just graduated from high school a few weeks prior and had no way of knowing how that data would impact my life less than 5 years later, as guys with whom I worked in Atlanta restaurants and bars, my friends, my peers, began to fall ill and die in the most horrendous and hopeless ways imaginable. Whew. It was so horrific that I had to escape, or so I thought. In the spring of 1989, I packed my bags and headed to Provincetown, Massachusetts, where after spending that summer and part of the following, I moved lock, stock, and barrel. Now remember, I was trying to escape AIDS. In Provincetown, I found a community that to this day is like no other I've ever known. I now know that we were all living with PTSD, but we also took care of our own. Some friends and I began volunteering for what was then the Provincetown AIDS Support Group, now the AIDS Support Group of Cape Cod. We also started a fundraiser, a drag show fundraiser, Sisters in the Name of Love. It was through that fundraiser that I met Alice Marie Foley, one of the most powerful forces I've ever met in my life. Alice plucked me from obscurity, or more accurately, from the floor of Gallerani's Cafe, to fill a new position that had been recently funded by the Massachusetts Department of Public Health, and thus public health chose me. I want to continue on a mission in which I find myself. A few weeks ago, I had the honor of delivering the commencement address at the Penn School of Social Policy and Practice. In that talk, I challenged those graduates to draw upon their education and training to hold duality, to bridge divides, to be the adults in the room and not resort to vitriol and acrimony when disagreements arise. Duality is a concept that resonates in a social policy and practice space. Here among you public health practitioners, I'll use a word that Kevin and Stewie and Abby and others have heard thousands of times from our beloved Jean, concomitant. If you know Jean McGuire, you. Even as we acknowledge the times in which we find ourselves, and sound, as Longfellow wrote in The Midnight Ride of Paul Revere, his cry of alarm to every Middlesex village and farm, a cry of defiance and not of fear, a voice in the darkness, a knock at the door, and a word that shall echo forevermore. Let us also concomitantly remember that ours is a calling, a duty that extends beyond ourselves, beyond those with whom we agree, and must even be inclusive of those who denigrate us, devalue the work that we do, and concoct conspiracy theories that are harmful to the communities we serve. We still gotta work with them. Our obligation is to defy and not fear rebuking conspiracy theories. Indeed, we have to be a voice in the darkness of misogyny, homophobia, racism, and religious intolerance. As I watched a sitting US representative attack Dr. Fauci earlier this week, it was clear to me that the attack on Tony is proxy for an attack on public health. Just as diversity, equity, and inclusion are under attack, so is public health, and we cannot see the ground. Still, my friends, concomitantly, for public health to work, we must at least attempt to earnestly engage with those with whom it would be so much easier to avoid. I'm saying that if we don't find ways to engage these people, our next pandemic, and no one disagrees that we will have another, will be much worse. Yet, even as we work to mitigate the dis and misinformation and the ongoing resistance to health prosperity for all, our efforts must remain on developing, implementing, and ensuring permanent sustainability of health equity in our Commonwealth, across the nation, and around the globe. For me, Massachusetts is the apex. It just is. Seriously, consider the most consequential leaders in policy and politics, and I'd wager that 95% of them have come through Massachusetts. We set the trends, we set the way forward, we set the standard, we develop the policies and procedures that get replicated elsewhere, and we have an opportunity to do so again. I am wrapping up. In this month's Health Affairs Journal, a commentary of which our own John Auerbach and Pistola are two of the four co-authors, we read, "Public health in the 21st century can become more powerful and effective in addressing health disparities and improving health status broadly by building on lessons of the COVID-19 pandemic and engaging the creativity, resourcefulness, and wisdom of communities throughout the U.S. The diversity of U.S. society represents one of the nation's greatest strengths. Communities, especially those experiencing the greatest health disparities, must be supported in working alongside public health departments to identify priorities and design, implement, and evaluate programs to address the multifactorial causes of poor health. They must be treated as experts in the lived experiences and local assets and barriers that can so deeply affect health policymakers at the federal, state, and local levels, and have an important role to play in facilitating this transformation through policies that support CBOs and community health workers with funding, technical assistance, and formal roles in decision-making that build the trust and community capacity needed for the U.S. to become healthier, thriving, and a more just society." In my last 20 seconds, their words, not mine. In my last seconds, I want to acknowledge people who aren't even here, but who influenced my public health growth in multiple ways. Bill Furden of the AIDS Support Group of Cape Cod and Barry Callis of the HIV/AIDS Infectious Disease Bureau of Massachusetts Department of Public Health are two men who have for decades gone about doing the work without fanfare, without attention or recognition, yet they have saved thousands of lives, helped as many die with supportive caring services, and been there for their brothers and sisters. And so I dedicate this award to them with eternal gratitude for their leadership and service. Thank you so much.
Uh-oh. I don't think that was supposed to happen, but it did. Good morning, everyone. Okay. My name is Omi Amarasingham, and I'm the Deputy Director here at MPHA. I would like to invite the MPHA staff to very reluctantly come on stage and be acknowledged. They're trying to get out of it until the very last second. Are so shy. I'm joined on stage by the small but mighty MPHA team: Carlene Pavlos, Ana Hidalgo, Veronica Cañas, Alexis Walls, Janezka Roman, Kate Forrest, and our graduate student intern, Julia Geske. I'd also like to acknowledge Tony Troop, our communications consultant. These incredible women are responsible for all the work that I'm about to tell you about, so please give them a round of applause. Well, we are tight on time, so I'm going to just share a few highlights of the incredible work that we have done over the last year to improve the health of our state, our communities, and our own organization. We did so much this year that I am not going to talk about. We signed on to amicus briefs advancing public health in the First Circuit and at the Supreme Court. We hosted our second annual Public Health Lobby Day at the State House. We testified at over a dozen public hearings in support of bills on housing justice, rent control, public benefits, health equity, healthy food access, and so much more. We rallied, we organized, we lobbied, we educated, we wordsmithed, we Zoomed, we learned, we led, and we followed. I am going to share updates on 3 of our priority legislative campaigns and close with some exciting news of what's to come for MPHA. So many of you have heard our clarion call for local public health infrastructure and regional public transportation, and I will share updates on those campaigns in a few minutes. But first, I'd like to tell you about a newer and urgent campaign that MPHA joined this session to legalize overdose prevention centers here in Massachusetts. As a policy organization, MPHA faces head-on the fact that historically, public policy has been used in this country as a tool to uphold a system of racial hierarchy. For me personally, there is no better example of this than the so-called war on drugs. From its inception, the war on drugs was grounded in violence, politics, and racism. President Nixon declared the war on drugs in June of 1971. John Ehrlichman, a top Nixon aide, revealed in a 1994 interview that was published in 2016 that the war on drugs itself was designed to target Black people and hippies. Ehrlichman said, and I read the quote, and I'll read the quote verbatim, quote, "The Nixon campaign in 1968 and the Nixon White House after that had 2 enemies, the anti-war left and Black people. We knew we couldn't make it illegal to be either against the war or Black people, but by getting the public to associate the hippies with marijuana and Blacks with heroin, then criminalizing both heavily, we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did." End quote. Ehrlichman's words are confirmation that a fundamental goal of the war on drugs from day one was to criminalize and terrorize Black communities with an explicit focus on Black and anti-war leaders. The war on drugs should thus be viewed for what it was: backlash to the civil rights movement and the anti-war movement. In the 50-plus years since, federal and state laws have primarily been used to double down on the war on drugs, leading directly to mass incarceration and the criminalization of Black and brown communities. In addition to causing profound trauma and family separation, incarceration and criminal records cut off access to the social determinants of health, including housing, education, public benefits, employment, healthcare, and voting. We usually talk about the failed war on drugs, but if you consider the motives and desired outcomes of its architects, by their measures, it's perhaps one of the most successful policies of our lifetimes. What the war on drugs has absolutely failed on is its public-facing promise of safety and health. Even in Massachusetts, which declared the opioid epidemic a public health crisis 10 years ago, the stigma, fear, and entrenched policies of the war on drugs persist and undermine public health to this day. As the commissioner already mentioned, overdose deaths in Massachusetts hit an all-time high in 2022, with 2,357 people dying of overdoses in our state. And in recent years, racial disparities in overdose death rates are getting wider. Between 2021 and 2022, the rates of opioid-related deaths increased for Black women by 47%, increased for Black men by 41%, increased for Hispanic women by 36%, and increased for Hispanic men by 12%. This legislative session, MPHA has joined forces with people in recovery, parents who have lost children to overdose, healthcare institutions, and labor and civil rights groups in the campaign to legalize overdose prevention centers in Massachusetts. Overdose prevention centers, or OPCs, are evidence-based public health tools that save lives. OPCs are spaces where people who use drugs can consume pre-obtained controlled substances under the supervision of trained staff. Rigorous academic peer-reviewed studies confirm that OPCs advance health and safety. OPCs reduce morbidity and mortality. They decrease transmission of infectious disease. They promote safer behaviors, and they connect people to treatment. Every single overdose death is preventable. But because of the legal landscape, created by the war on drugs, state law must be changed to allow an OPC to open here in Massachusetts. MPHA and our coalition partners are supporting a bill that would allow communities to open an OPC with local Board of Health approval. But despite the urgent need and clear benefits of OPCs, our campaign faces political challenges due to fear and stigma. Over the last year, public health leaders have bravely stepped up in profound ways to dispel myths, educate policymakers, and put forward human and public health-centered drug policy that saves lives and promotes safe behaviors. Cambridge, Somerville, and Northampton and other cities are taking steps to support OPCs in their communities. And just a few months ago, the Worcester Board of Health voted unanimously to support an overdose prevention center in Worcester, pending authorization from the state. But local public health cannot do this alone. As we head into the busiest 2 months in the legislative session, we must see action on Beacon Hill. This session, MPHA also continued our multi-year campaign to transform the local public health system into one that affords basic public health protections to all residents. Together with local public health partners, we are working to pass a bill known as SAFE 2.0 in the face of mounting public health crises, and candidly, a simultaneous loss of momentum as the political machine has moved on from the hard lessons of COVID. Through the Public Health Excellence Grant Program created by predecessor legislation SAFE 1.0, local public health officials have responded to the myriad public health crises dominating the headlines today. Public health excellence collaboratives have used state funding to purchase translation devices to be able to reach more people who speak languages other than English. Groups have also used funds to stand up health clinics to serve new migrants in their communities. Public health excellence collaboratives have supported prevention and harm reduction services, including hiring staff to oversee opiate settlement funds distribution and conduct Narcan trainings. With a track record of legislative support, a strong coalition of local public health leaders, and partnership from the Healy-Driscoll administration, we hope to celebrate passage of SAFE 2.0 this year. Finally, it's budget season, and I'd like to share some highlights and wins in the state budget process so far. Followers of our work will know that we are poised to see historic investments in regional public transportation as a result of a strategic campaign led by MPHA and transit advocates. With the arrival of dedicated transportation and education funding through the Fair Share revenue, MPHA and partners in the Regional Transit Authority Advocates Coalition set ambitious goals to secure significant state budget investments to finally fully fund the state's 15 regional transit authorities, or RTAs. In addition to organizing and advocacy, communications has been a key to success in our RTA campaign. 2 years ago, RTAs were barely a blip in media coverage outside of a few regional stories here and there. Our campaign to create and move a media narrative in support of regional public transit has paid dividends. In the last year, over 23 news stories, articles, op-eds, and letters to the editor have been published on RTAs, and the results speak for themselves. Last year, the legislature met our ask and funded the RTAs at $150 million, up from just $94 million in the previous year. This year, we are again expecting the legislature to exceed this high watermark with even more funding for RTA operations, fare-free pilot programs, and transit innovation grant funding. Policy and funding wins are really just the beginning. We all know that implementation and protecting investments are key ingredients to sustainable success. And after 1 year of increased RTA funding, RTA riders across the state are already seeing real improvements in service, with many RTAs offering evening and weekend service for the very first time, some doubling the frequency of service on important bus routes, and service expansions to better meet the needs of older adults and people with disabilities. But we don't do any of this work alone. Many of you in the room have been leaders in all of our coalitions and the work that we do. Please you raise your hand if you are in a coalition with MPHA. I know there's more of you on my Zoom calls. Please raise your hand if you have called or emailed your state rep or senator on an MPHA priority. Please raise your hand if you read our newsletter and have shared it with friends or colleagues. That's pretty good. Our open rates are pretty high. If you did not raise your hand, or even if you did, don't worry. There is plenty of time to take action on all of these priorities as we head into the last 2 months of the legislative session. And this fall, we'll be developing our new round of policy priorities for the next 2-year session. The last thing I want to tell you about before I leave the stage is MPHA's strategic planning work. Prior to COVID, MPHA's board endorsed 2 fundamental commitments: dismantling structural racism and listening to the voices of those experiencing inequities in developing our policy priorities. These commitments have served as a touchstone in our work with local communities by centering the voice of people as our barometer for change and shifting power to the grassroots community-based organizations to enhance their success. For the past year, through our strategic planning efforts, we have worked to embed these fundamental commitments into a revised mission and vision statement. And hopefully they are up on the screen. Great. Additionally, MPHA is moving forward with 4 new commitments, including humility, trustworthiness, a commitment to shifting power, and a commitment to transformation. Details about these new commitments and about a new name for this great organization that matches our mission, vision, and values will be unfolding over the next few months. Please stay tuned to learn more and share with us your thoughts about how this transformation inspires you to join this alliance of public health advocates to make real, substantive change for justice and health equity. We are going to need all of you to see yourselves in this movement, so we can't wait to deepen our connection and our shared work. So thank you all for being with us this morning. It's now my pleasure to welcome to the stage Cheryl Bartlett, former DPH Commissioner and CEO of New Bedford Community Health. She is also a former recipient of the prestigious award she is about to present and a MPHA board member and co-conspirator. Welcome, Cheryl. Do you want to hold it? I don't know how to put it in here.
Not that coordinated.
I need help.
We need technical help.
I need tech support. Thank you.
Thank you. Good morning. It is always great to be here and see so many friends. And here we are again, another Spring Awards breakfast. It's always inspiring to come together with friends and colleagues to celebrate Massachusetts leaders who make a difference every day in their communities, the state, and the country. Once again, we celebrate this year's awardees for their leadership, their commitment, success in their careers, and the impact they have across the state. This year's honorees have especially given me a pause, reflecting on the importance each of them played in my career, in my work. And actually, in thinking about them, I worked with each one of them in a different pandemic. Douglas Brooks and I began our public health careers together on the Cape and the Islands, the emerging HIV and AIDS pandemic, to work to bring more resources to reduce stigma and fight for the people we cared for, our families and friends impacted by this pandemic. Douglas, our mentor, the late Alice Foley, I'm so glad you mentioned her, she'll bring a tear to my eye, is surely looking down on you today, so proud and with joy. I'll forever cherish our work together and am proud to call you my friend. Dr. Mark Kerouac. When no CEOs wanted to open their doors to their hospitals and take care of patients with Ebola, you stepped up and said Bay State is willing to be a center of excellence for Western Massachusetts. At that time, patients were being flown to Wisconsin, if you recall, where there was one of the country's only places to safely take care of patients with highly infectious diseases. The Obama administration asked commissioners across the country to identify 3 to 5 centers of excellence because we felt like we needed to concentrate the resources. It was challenging to take care of these patients, to learn how to don and put on your clothes and take off your protective equipment. I actually got to do that in person at Bay State Medical Center. You accepted that call to action when there were crickets on meetings where I asked for people to do their part. I'll be forever grateful for your leadership in public health, and congratulations today. And now it's my pleasure. Yes, please. Thank you. On behalf of the MPHA Board of Directors, to present Helena De Silva Hughes with the Lemuel Shattuck Award for her passionate commitment to the health and well-being of immigrant communities in New Bedford and across Massachusetts. Helena, herself an immigrant at the age of 10 from Portugal, leaving a terrible dictatorship, came to New Bedford. She has devoted 40 years of her life, her career, at the Immigrant Assistance Center in New Bedford. Helena is one of those rare individuals who never shuts out her light. When something needs to get done, what do they say? Ask a busy person. She is that person. She is respected and sought out to bring her voice on the immigrants' needs to every table in the region. I met Helena 7 years ago when I became the new CEO of New Bedford Community Health, and I needed to get out in the community and find out who I needed to partner with. And I saw that she was hosting a party, I didn't know her, a summer fundraiser garden party at the Madeira Center, and I thought, well, I'll go there. I actually have Portuguese roots, so it had a little bit of attraction to me, and attend this party and see who I could meet. I made sure to introduce myself to Helena, and from that day forward, everywhere I went, there was Helena. Every meeting with the mayor, with the community, serving on the board of South Coast Health. Always a breath of fresh air and offering her wisdom on how we can better support immigrant communities. Helena was a critical voice during the COVID pandemic, my 3 pandemics. She left no stone unturned, from attending faith-based services, providing information to the communities wherever she could meet them where they were at, and also hosts a weekly TV station that reaches a large Portuguese-speaking audience, where we were able to convince her to have one of our Portuguese-speaking nurses from the health center vaccinate her live. So she really was demonstrating that this was a trusted vaccine in the immigrant community. There was a lot of misinformation that the vaccine was not safe. She is someone who does not back down when facing barriers to achieve the mission of Immigrants Assistance Center. New Bedford and Massachusetts are better places with Helena Da Silva Hughes, the 2024 Lemuel Shattuck Awardee from MPHA. Please join me, my friend, Helena. Coordinated as Harold posing.
Thank you so much. I'd like to first of all thank South Coast Health for being here, and my husband Peter Hughes for all of his support. And he keeps telling me I need a hobby. So let me tell you a little bit about myself. So it is with pleasure, great pleasure and honor to receive such a prestigious award from MPHA. Thank you, Cheryl, for all of your support and for being a partner of the work that we do at the center. As I look back at my 40 years of services at the Immigrants Assistance Center, I always feel humbled and honored to have had the opportunity and privilege to serve our immigrant community. As an immigrant myself, who immigrated at the age of 10, with my mother and 6 siblings in 1971, to join my father, who had arrived in the United States in 1969. I saw every day how my parents worked long hours to meet the basic needs of their families. The topic of education was at the forefront of the conversation, and how had they immigrated to give us a better life. My father always said that if we worked hard and stayed in school, anything was possible in the U.S. My parents had a 4th grade education from their native country of Madeira Islands, Portugal. My grandparents were illiterate in their own language. I recall the sadness of my grandmother every time she needed to sign a document and place an X next to her signature. Due to Portugal being under dictatorship until 1974, education was not an option. I remember as a kid going to the doctor's office with my grandparents and my parents to translate. I was always afraid that I might not be translating correctly and how that could impact their health. It is with those early experiences as an immigrant that gave me passion, vision, and energy to make sure that our vulnerable immigrant voices were heard. Throughout the years, I always spoke about health disparities and the injustice that I saw happening in schools with our immigrant children, with our immigrant families. For decades, the health disparities in our immigrant communities were so obvious, but even though the topic was discussed, it seemed to fall in deaf ears. It took a pandemic for leaders to start listening and to changes in state and local policies to happen. I always said that if policies are not intentionally, changes will never happen. I'm beginning to see that the Department of Public Health implementing policies and delegating funds that will intentionally make a difference in our immigrant communities' health outcomes, but we still have so much work to do. The MPHA Health Equity Policy Framework is a guide that we should all follow to achieve health equity in Massachusetts. Receiving this award from MPHA has a tremendous meaning to me. It aligns perfectly with the advocacy work that is provided daily at the Immigrants Assistance Center. I look forward to continue our partnership with MPHA and all of those who are here this morning to dismantle this structural racism and to address the root causes of health inequities. Thank you so much.
Congratulations, Helena. It is now my pleasure to welcome Craig Andre to the stage. Craig is Associate Dean of Practice and Director of the Activist Lab at Boston University School of Public Health and a member of MPHA's board. There you are.
Morning, everyone. Pleasure to see you. I am here, first want to acknowledge one of my mentors, Harold Cox, who last year, again, is holding on to, and this year, his label as eye candy. Bless your heart. Last year, when I came up to encourage and support your investment in Mass Public Health Association, I called myself, as my lifelong veganness says, your eye broccoli. So now I'm here as your investment advocate. I'm trying to open up your wallets. I often, and I see, I hope on the screen are the ways that you can give today, making sure that you can present via text and also, is it on the screen? Yeah, good. So I often introduce myself as Penny's son. My mom was a teenage mom, me and 4 boys. I, in many ways, dedicate my public health practice to who and what she was all about. First of all, she made this. And my other more average brothers. And she raised us in an environment in public assistance in the housing projects of Jamaica Plain and Brockton, in an environment that was filled with violence and hunger and broad spectrums of trauma that also amplified the love that was in our home. She told every one of my brothers and I that we could be anything we wanted to be as long as we kept our heart full. This is in an environment where the system wasn't created for her or for us. The reason that I joined the Mass Public Health Association is because they are centering all the people in our Commonwealth. Their advocacy, their commitment to racial equity and social justice is unparalleled. I want to say that again. Their commitment to Black love, queer love, Latino love, disabled love, Indigenous love, bringing all people in to the center in a way that we all feel seen, heard, and valued. we have, on an ongoing basis in our board meetings, have deep, hard conversations around race and religion and class and the ways that our system serves us poorly. And finding ways, what that means for us as individuals, what it means for us as a collective to make a difference so that people can feel it, regardless of their zip code. This is what I'm asking you to invest in. When we have those hard conversations, we bring the heat and we bring the sweet. It's critical that we recognize that this is a time that we have to fight for the public's health. We have to give and push and show up and recognize that the only way that we're going to make a difference and move against the whole of anti-public health is to promote pro-public health policies and be able to help people see that they have someone along their side when we're fighting for their health. Now, let me get serious about how I demonstrate that commitment. 1 second. So can I get serious with you right now? I am willing to do anything to get you to give till it hurts to public health. So I am going to show you my example of how I wear this flower in a way that helps people understand that I will do anything. So look on the screen, see what you could do. What will you give now at this moment to text and make sure that we can make the goal of 25,000 here in this moment? And I'm going to go around and give you some other examples of the commitment that others are doing to be sure that you understand how much we'll degrade ourselves to have you align with Mass Public Health Association, invest in the work that we do for the community and for that fight for the public's health. So follow me. Would you stand, Cheryl? Bring those cameras right here.
Oh, now we're talking.
Now, does she bring the heat and the sweet? How much would you give for this? I'm asking. Show us how much you will give for this kind of relationship building, policy breaking, ways that make the change across the Commonwealth. Is this pretty inspiring, right? Wouldn't you like to be like her? All right. Stay, have a seat. Commissioner Goldstein, here is your shillelagh for the Celtics. Okay. Because you lead. Now take a picture here. How much would you pay for this? Show us. Give. Can you see him in front of the parade leading those advocates down the road, across the country, right back here to Massachusetts, making the change? Ra, can you see? Thank you. Follow me. Where'd Basola go? Oh. I'm looking for you, Basola.
What am I doing?
Here's a tambourine. Here's a sheriff's hat.
Are you serious right now?
How much would you pay for this? Give. A change agent, a person that is taking on the man and the woman that are trying to marginalize our people. Look at her. She is inspiring, is she not? Yes. Yes. You're inspiring all of us. And Stewie, stand up. Hold on to that. Hold on to this. Hold on to that. Take a picture. Giving until it hurts. So, what have we learned today? We have to fight for our public's health. We have to make sure that we spread the word of the value that Mass Public Health Association brings to every corner of the Commonwealth. That we will literally do anything to be sure that the public feels seen, heard, and valued. This isn't about us. This is about our communities and who we are with our communities, walking alongside. Whether we show up looking silly, we show up. We will not leave anybody behind in the next pandemic. We need to make sure that we bring all that local public health needs in a way that is ready to serve all of our community members, regardless of the zip code. No matter how long it takes, we need to show up for every single person and have them feel that they are seen, heard, and valued. Not that we just tell them. They need to know. If look around right now, really. This room is filled with greatness. We have enough power to make the change that our communities are asking for. We have the will. We need to continue to build the resources and understand that Mass Public Health Association is an alliance with every one of you and every one of our community members in a way that makes the difference that we want to see. We will get there with your help. Thank you for giving. Thank you for the work that you do. Thank you for everything, and thank you for tolerating this.
Thank you, Craig, and thank you to everyone who has given. Please don't stop now. We'll be accepting gifts through the end of the event, and honestly, every day after that as well. And you can help us make your goal. Remember, there are multiple ways you can give. There are envelopes on your table. This year, there are also pens. And in the back of your program book, there's a QR code and the instructions to text to donate. So if you have not donated yet, please do so. To present this morning's final award, the Public Health Leadership in Medicine Award, I'd like to invite Jessica Collins, Executive Director of the Public Health Institute of Western Mass, and Helen Colton Harris, Commissioner of Health and Human Services for the City of Springfield, and herself, a former Paul Revere awardee, to the stage. Jessica and Helen.
Good morning. Ooh, it's a little low. Dr. Kerouac, I am so pleased to be sharing this special honoring of you with Commissioner Colton Harris. Congratulations to you and your lovely wife, Dr. Arquette Ann, on this wonderful award. You have led a distinguished career, and over the past 10 years, you have done more than just give public health a nod. You have given public health 2 thumbs up and a consistent, firm, encouraging push to keep going. Coming from healthcare leadership, you have been unique in that regard, I think. And one of my favorite stories about you was in 2014 when Dr. Kathleen Zegda released the Springfield Health Equity Report through a race and health equity lens. It pointed out zip codes as a determinant, racism as a root cause, but also healthcare as potentially only 10% of quality and length of life outcomes. And we sent over the report to Dr. Kerouac, the new CEO of Bay State Health, and thought, what's he gonna say? And what he came back with was, can you guys send me over 25 more printed copies because I want to give every board of trustee a version. And from that point, we knew we were in good hands. You have been thoughtful, thank you. You have been thoughtful about community clinical linkages. You called out racism as a public health crisis and followed through by assessing and changing internal practices and policies. You have been a strong advocate and voice for Western Massachusetts. You were the first hospital CEO to create a vice president of public health, which is now an office of public health, serving our region and informing our state. Thank you for your partnership, your leadership, your discerning questions, your thoughtful feedback after reading everything we've ever sent you, and again, your coaching and encouragement. I am confident that your investments in public health and your consistent and gracious style of leading with dignity and compassion as CEO and as a physician, it has set the tone for 21st century healthcare practices that will continue to impact health equity for years to come.
Thank you. It is my absolute honor to be here to be able to present with Jessica Collins this amazing award to you, Dr. Mark Kerouac. I want to thank the Public Health Association for being smart enough to give you this award. You are a very special leader, not only in healthcare, but in the community. Dr. Kerouac is a leader who understands lessons in leadership is not in the journey, Dr. Kerouac is a leader who understands the lessons in leadership is not in the destination, but in the journey. Dr. Kerouac has embraced his journey and his power to make a difference and has fostered a movement that has created a change that has had a powerful impact on Bay State Health, the Western region, the Commonwealth of Massachusetts, and I dare say the nation. Dr. Kerouac is a leader who has personal integrity. He understands it is important how hospital staff at all levels treat each other, patients and the community in their daily interactions. He understands that we should always value the lived experiences of others. He operates with integrity, and there is no line he will not cross for the betterment of our community, patients, and staff. Dr. Kerouac is a leader that has a moral vision. I describe public health often as a social justice movement rooted in science. And those who do the work understand that the goal is to assure that access to health care and our public health framework should not be determined by who has power over whom. Dr. Kerouac has been the architect and true champion for healthcare and upholding that moral vision. Dr. Kerouac is a leader that exhibits courageous defiance. From his early career as an infectious disease physician, stepping out on the front lines of the HIV/AIDS epidemic, to his work today to educate around the COVID-19 pandemic, he understands you must educate, advocate, legislate, and oftentimes agitate. For 16 months as Commissioner of Health for the City of Springfield, every Monday morning, I stood beside Dr. Kerouac with other city leaders, including the mayor, to educate and inform a region around the COVID-19 pandemic. Be clear, Dr. Kerouac could have sent a surrogate. He did not. He stood with us every Monday morning. The public was anxious to hear his calm, steady voice. We delivered messages together that were not always popular. Mask up, stay home. The things that individuals in our community oftentimes impacted their lives. He understood that the Black and brown communities of the city of Springfield were impacted disproportionately, and other marginalized individuals in our community. But he stood firm. That is courageous defiance. Dr. Kerouac is a leader who understands the words of Gwendolyn Brooks. You and I are each other's magnitude and bond. We are the leaders, the teachers, and the healers that we have been waiting for. It is my honor to bring to each of you the amazing individual we have had the opportunity to work with in the Western region and in the Commonwealth and many in the nation. Dr. Mark Kerouac is a true leader, teacher, and healer. Please welcome Dr. Mark Kerouac.
Well, good morning, everybody. Thanks to MPHA for this tremendous honor. Thank you to Jessica and Helen for that very gracious introduction, and to my colleagues at the Public Health Institute of Western Mass for their kind nomination. You know, I've always been grateful for the education in public health I received right up the street at Boston University back in the 1990s. AIDS around that time was becoming a more treatable disease. I was looking for a new challenge in my life, and I enrolled to acquire skills in biostatistics and epidemiology to enable me to participate more fully in what was then the exciting new field of quality improvement in healthcare. It turned out that I got something far more valuable, a way of looking at the world. As a doctor, I was trained to deal with one sick patient at a time, but the lens of public health helped me appreciate the health status of entire communities and the social factors that are such powerful influences on how healthy someone can be. It opened my eyes to structural inequities and health disparities too. And once you've seen these realities, it's hard to unsee them. When I came back to my hometown of Springfield in 2011, Bay State Health was already the dominant provider of specialty care services for the 4 counties of Western Mass. The system was beginning a pivot, though, to adopt population health models of care, in which the entire healthcare needs of large groups of people would be managed under a global budget. Over the years, Bay State Health has been able to grow its involvement and sophistication in these models, such that now over 90% of a Bay State primary care provider's patients, in all about 250,000 patients, are managed under a global budget. It's the highest rate in the Commonwealth and one of the highest in the nation. The approach leads to team-based care, where caregivers work to the top of their licenses, with an enhanced focus on measurement, prevention, wellness, and access, resulting in improved outcomes. In Bay State Health's Medicaid Accountable Care Organization, with over 50,000 low-income participants, the care model also involves community health workers visiting homes to assess and address the social influences of health, as well as the deeper partnerships with social service organizations to combat housing insecurity, food insecurity, behavioral health issues, legal issues, and transportation. This same public health and equity lens led Bay State Health to focus on economic prosperity as a key factor in health, particularly in Hampden County, the poorest of the 14 counties of the Commonwealth and the one with the highest chronic disease burden. Before I even came back to town, under the leadership of Dr. Frank Robinson, our Vice President of Public Health, Bay State Health founded the Bay State Academy Charter School in Springfield, launched the Public Health Institute of Western Mass, and created an internship program for Springfield high school students that's allowed 500 graduates to start a healthcare career. In later years, the health system organized the Anchor Collaborative of large employers to foster diverse procurement, diverse hiring and advancement, and place-based investment. It also served as the lead grantee for the Digital Equity Alliance to address broadband connectivity in the western part of the state and digital literacy, which are underappreciated social influencers of health and success. Public health and health equity principles are also deeply embedded in the day-to-day operations of Bay State Health. Our health system goals are linked to the compensation of about 200 top leaders and focus on improvement in key measures of safety, quality, experience, and value, or affordability. Now, whenever possible, and in about half of cases, these goals feature measures broken down by race and ethnicity with an expectation that we're going to narrow health disparities. Workplace policies also have been analyzed for their impact by race and ethnicity and revised when necessary to address structural racism within Bay State Health. Our education and research programs have been designed to build awareness of social issues as well, with the development of a novel medical student curriculum for the regional campus of UMass Chan Medical School and the commissioning of a highly productive academic department of healthcare delivery and population science. When COVID-19 came to Western Mass, Bay State Health was more ready than most health systems. A discussion of all the aspects of our response would be a whole other talk, but let me at least say that the prior work that the system did to develop a sort of central nervous system through clinical integration, a culture of continuous improvement and learning, a commitment to improved access to care, and a focus on the health of the whole community positioned us well to lead when that once-in-a-century pandemic hit. Speaking to a room full of public health professionals, I'm mindful that most of you would have focused on similar issues had you been in my place. But the challenge for health system leaders these days is not a lack of knowledge of the right thing to do. It's overcoming the significant headwinds preventing us from doing the right thing. As the leader of the preeminent delivery system in Western Mass, and one that's the sole provider of many essential services like level 1 trauma care and neonatal intensive care, I also need to be mindful of maintaining the stability of the delivery system that employs over 13,000 individuals and requires about $6 million a day in cash flow to keep it going. Current financial incentives in our health system reward a focus on individuals with commercial insurance, which for some larger health systems pays more than twice the rate of Medicare. These incentives, sadly, also reward reducing the system's exposure to the Medicaid program, which pays well below the cost of delivering care. Even within payer categories, procedural cases have a higher financial yield than the care of those with medical, degenerative, or behavioral health problems, leading many systems to over-resource and market the former at the expense of the latter. For most urban centers in America, these disparate payment schemes have led to a two-class system of care. A two-class system of care in which a few heavily subsidized health systems focus on lower-income individuals, freeing the rest to compete for the well-insured. On the other hand, in mid-sized cities like Springfield, that don't have a specialized safety net hospital, the patchwork system has historically required a delicate internal balancing act in which excess margin from well-insured cases is used to subsidize shortfalls for the care of low-income and uninsured individuals. You can see that for an average health system, the barriers to a public health approach are significant. Which brings me to another thing I'm grateful for, that I've been able to lead a health system in the enlightened state of Massachusetts. While our state hasn't eliminated the perverse incentives of our financing system, we have tamed them somewhat by encouraging population health-based models of care for Medicaid patients, restraining rate increases for commercial managed care, and using progressive taxation schemes to transfer money from hospitals with high commercial payer mix to those with a high Medicaid payer mix, all the while taking advantage of federal matching funds. I want to acknowledge the efforts of the Executive Office of Health and Human Services in launching and extending these efforts, and in tying some of the reimbursements to quality and equity measures. We still live with multiple payment schemes with complex and ever-changing rules, but of the 50 fragmented approaches in play in our country, Massachusetts, in my opinion, is the best, and our top ranking in many of the state health assessment scores bears this out. On Monday, I stepped down after 10 years as the CEO of Bay State Health, and after a 44-year career in healthcare. I started my career in a world before AIDS and COVID, before quality measurement and the use of computers in healthcare, before molecular diagnostics, minimally invasive surgery, systems of hospitals, employed medical groups, and before the widespread awareness of the social issues that impact health. I've been blessed to witness and participate in a revolution in the way care is being delivered. One of the most impactful aspects of that revolution has happened right here in Massachusetts, a state that knows something about revolutions. The gradual and inexorable application of the public health lens to all aspects of the delivery system, which led to a growing focus on measurement, prevention, wellness, and equity. I know that Bay State Health has been able to move further on this journey than many, owing to the work of those who came before me, my own training in public health, the system's relative geographic isolation, and the option of population health models of payment in our state in virtually all payer categories. My most fervent hope is that we in Massachusetts will continue our progress and continue to show the way in these trends so that our whole country can benefit from a true system of care that focuses on the health and well-being of all. Thank you again for this tremendous honor.
congratulations again, Dr. Kerouac. And congratulations to all 3 of our amazing awardees. If you didn't know before why we were giving them awards, you definitely do now, right? After hearing about them and from them. Very quick, I'm going to be very quick before I let you begin to talk to one another again. Just a few more thank yous to our sponsors, Gilead and Bay State Health. Thank you so much for the support for this event. I know a lot of people have already thanked the staff of MPHA, but I haven't gotten to say that yet, and wow. They're just incredible and such a pleasure to work with and so good at what they do. So thanks, y'all. Thank you. I want to say, just return just for a moment about something that Omi spoke about in her remarks about the strategic planning that MPHA has been undergoing. Now is the perfect time for MPHA to be doing strategic planning. COVID has changed a lot in the public health landscape, but a lot has also changed for MPHA because of our deepening and sincere commitment to dismantling structural racism. And if we are going to take that seriously, and we are going to and do, then we need to change. The board, the staff, and our policy council all hope that you will see this evolution as one that is meant to make MPHA and our entire alliance of partners and allies out there more effective and more trustworthy advocates for disruptive and necessary change in the cause of justice. We hope that you see your hopes for your family, your community, and this state reflected in our priorities and commitments. And we really hope you will join us in this work. As Steve said at the very beginning of the day, we're approaching our 150th anniversary. That comes up in 2029. It's less than 5 years away. And when that anniversary comes, we want to look back and say that we've set ourselves on a path for justice and for true equity in the state of Massachusetts. So stay tuned. Hold us accountable to those commitments that we're making, and join us in this movement. And speaking of joining us, we are about halfway to our goal today of raising $25,000. We can still do this. It's not that much money in the grand scheme of things, but it makes such a difference to MPHA. So if you haven't had a chance, you still can. We're keeping the text to donate open until 5 o'clock today. So it's text SAB 2024, that's Spring Awards Breakfast, get it? 2024, to 4231. Did I do that right? 4231, Anna? 44231. I knew something sounded off. Okay, wait, somebody say it to me. 44321. That was from our Paul Revere awardee, so you know it's right. And if you haven't yet participated in the Catalyst Corner, but you're feeling so jazzed about being part of a public health alliance, it's the perfect moment to do it. Be part of that interactive exhibit. You can have a photo taken, you can have a video taken, you can just write something on a Post-it and put it on the wall. And don't forget, there are lots of ways to stay in touch with us throughout the year. If you're not signed up for our newsletters, it's a very easy thing to do. There's a QR code on the back of the program book, so sign up for our newsletter and our emails, and come to events. Come to an event at the State House, come to a rally, or just come to our annual conference in December, where we will be releasing our new public policy agenda. And stay tuned. You can read all about that on our website and the newsletter, and I hope you all have a great day. There's still coffee, and you can hang out here until 11. Thanks.